Hello everyone, my name is Hema Yamini. I'm a respiratory physician from Queen Elizabeth Hospital, Kota-Kinabalu, and today I would like to share with you all a little bit about lung cancer. What is lung cancer? So cancer itself is a disease in which cells in the body are growing out of control. When the cancer starts in the lung, it is called lung cancer. Lung cancer begins in the lungs and may spread to lymph nodes or other organs in the body such as the brain. Cancer from other organs can also spread to the lungs, and these are known as secondaries. Are there different types of lung cancers? So lung cancers usually are grouped into two main types called the small cell lung cancer and the non-small cell lung cancer. Non-small cell lung cancer are further divided into adenocarcinoma, squamous cell carcinoma, as well as large cell carcinoma. Why is it important for us to know what type of lung cancer a patient has? This is because these types of lung cancer grow differently and are treated differently. Non-small cell lung cancer is more common as compared to small cell lung cancer. How common is lung cancer in Malaysia? Lung cancer is the second most common cancer worldwide. It is the most common cancer in men and the second most common cancer in women after breast cancer. There were more than 2.2 million new cases of lung cancer in 2020. In Malaysia, lung cancer is the commonest cancer among males and the third most common cancer in the general population. 60% of lung cancer cases in Malaysia were detected at a later stage, at stage 4. The average male smoker had an approximately 9 to 10-fold risk of lung cancer, whereas heavy smokers had at least a 20-fold risk. In 2015, 5 million Malaysians aged 15 years or older were smokers. Thus, lung cancer will remain a major public health problem for decades. So, what are the risk factors for lung? Smoking is the number one risk factor for lung cancer. Tobacco smoke is a toxic mix of more than 7,000 chemicals, and at least 70 are known to cause lung cancer. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who do not smoke. The more years a person smokes and the more cigarettes smoked each day, the more at risk the patient is to develop lung cancer. Passive smokers are people who inhale smoke from other people's cigarettes. This can also cause lung cancer. When a person breathes in secondhand smoke, it is like he or she is smoking. Other risk factors include exposure to gas such as radon, exposure to asbestos, certain occupation where patients are exposed to arson, diesel exhaust, and some forms of silica or chromium. Genetics. Risk of lung cancer may be higher if parents, brothers, sisters, or children have had lung cancer. We've spoken about secondhand smoking. Pollution is also a risk factor for lung cancer. What are the symptoms of lung cancer? Most people with lung cancer don't have symptoms until the cancer is advanced. And different people may have different symptoms for lung cancer. Some people have symptoms that are related to the lungs, such as persistent cough, shortness of breath, coughing up blood, unexplained weight loss, and repeated respiratory infection. Some people whose lung cancer have spread to other parts of the body have symptoms specific to that part of the body. For example, patients who have had lung cancer which is spread to the liver may have abdominal pain, or if it's spread to the bone, may have bony tenderness. And how is lung cancer diagnosed? A chest X-ray, a chest radiograph, is usually the first test used to diagnose lung cancer. However, chest X-ray cannot give us a definitive diagnosis because they often cannot distinguish between cancer and other conditions like infection. If chest X-ray is suggestive, further tests are needed for confirmation. So if a patient comes with symptoms suggestive of lung cancer, chest X-ray is always the first test to be done to give us an idea about what is going on in the lungs. A CT scan uses X-rays to make detailed cross-sectional images of your body. Instead of taking 1 or 2 pictures like a regular X-ray, a CT scanner takes many pictures and a computer then combines them to show a slice of the part of the body being studied. So a CT scan is more likely to show lung tumors than chest X-rays. It can also show us the size, the shape, the position of the lung tumors, and it can also find any enlarged nodes, lymph nodes, that might contain cancer that has spread. The tests can also be used to look to see if the cancer has spread to other organs, such as the adrenal glands, the liver, the brain, and others. Once we know that there is an abnormal growth in the lung, then the next step is to biopsy the lesion or to take a sample from that lesion. So there are few different approaches to take biopsy from the lesion. Okay, this would depend on where exactly the lesion is. Is it close to the airways, or is it at the periphery of the lung? Is it within the lymph nodes? And the location of the lesion will determine what sort of approach is taken for a biopsy. So the different approaches include bronchoscopy, CT or ultrasound guided biopsy, fluoroscopy, and a surgical biopsy. So bronchoscopy is a procedure done with a bronchoscope, which is a thin flexible tube with a light and a lens or small video camera at the end. The tube is put in through the nose or the mouth, down into the throat, into the trachea, and into the airways of the lungs. So over here you can see that this is a bronchoscopy which shows that there's an abnormal growth in the right main bronchus. Here a forceps is used to take biopsy from an abnormal area visualized during bronchoscope. Image-guided biopsy, CT or ultrasound-guided biopsy, is usually performed when the lesion is at the peripheral area of the lung. Alright, so over here you can see the lesion is not in the central, but the peripheral area of the lung. So here, a needle is inserted through the chest wall via a CT or ultrasound guidance into the suspected area to obtain a tissue sample. This test is performed by radiologists. Fluoroscopy is a procedure performed to examine the pleura, the pleural cavity, and obtain biopsies from the parietal pleura by introducing an endoscope into the pleural cavity under direct vision. It is also used to perform therapeutic interventions within the pleural cavity. A malignant effusion is a buildup of fluid and cancer cells that collects between the chest wall and the lung. The area between the chest wall and the lung is known as the pleural cavity. This is how it normally looks. But when there is accumulation of fluid, then this is how it looks. And on X-ray, you can see this is the normal lung, and here there's accumulation of fluid. And this occurs because there is spread of the cancer to the pleural cavity. This is commonly seen in late stages lung cancer. This is a video of fluoroscopy performed in our hospital. So an incision is made in the chest wall, and the fluoroscope, which has a camera at the end, is inserted into the chest wall, and pleural cavity is visualized. So here you can see the collapsed lung, and this is the wall which is covered by the parietal pleura, and it looks abnormal. Here you can see that these abnormal areas are biopsied using a flexible forceps biopsy. Surgical lung biopsy is performed by cardiothoracic surgeons under general anesthesia. It can be done through VATS biopsy, which is an minimally invasive method where an endoscope or a camera is inserted through the chest wall into the chest cavity. Various types of biopsy tool are inserted using different pots to obtain lung tissue for examination. Open biopsy, on the other hand, is when an incision is made on the skin, on the chest, and a piece of lung tissue is surgically removed. How is lung cancer treated? Types of treatment include surgery, chemotherapy, radiation therapy, where high energy rays are used to kill the cancer, targeted therapy, and immunotherapy. Traditionally, surgery, chemotherapy, and radiation were used. Surgery mainly means resection of the tumor, and this is usually done in early stages of the lung cancer when the cancer has not spread to other organs. Chemotherapy is basically using intravenous drugs that attacks fast-growing cells, fast-growing tumor cells. Radiation is when high energy rays are used to damage or kill the cancer cells. Recent advances have allowed doctors to further individualize their patients' treatment with precision medicine. Targeted therapy is when medical treatment targets cancer-specific genetic changes to slow down tumor growth and to kill cancer cells. Immunotherapy is a special drug which helps the patient's own immune system to fight cancer. These are a few of my take-home messages. Smoking kills, and it's never too late to stop. It could save you from lung cancer. Seek treatment early if you or your loved ones develop symptoms to suggest lung cancer. Thank you very much for listening.